Sarah, as you'll see by her title, is the new chair of Health Systems Global, and I think we're delighted.
You're staying there. Okay. I have an on-stage audience, which is wonderful. Thank you very much. It's an honor to take on this final closing phases of the symposium, although I have to admit that I'm a little bit jealous of Sisonke, as she got to start the symposium with a dinner party, and instead I get an official closing. Particularly given the wonderful energy that we've seen here, I think, throughout the 3 days of the symposium, and particularly last night on the dance floor, which was quite something to be beheld, I think. Freshly Ground did an amazing job. It was a wonderful night out. So I would like to see this as the final hurrah, rather than the closing ceremony. But that said, I have quite a lot to get through if you're going to try and make it out of here in good time. But we need to share some secrets, some things that we haven't told you about yet. We need to announce some winners. And as polite guests at the party, we also have to say some thank yous. However, first I have some rather serious business. In the past years, the symposium has produced a final statement that seeks to summarize the nature of discussions that have taken place and the learning shared, as well as the implications for different actors going forward. And this year is no exception. You may be aware that there is another statement that is also circulating. So just to be crystal clear, there is one statement which I think is coming out of the Alliance for Health Policy and Systems Research in USAID primarily, which is around implementation research, which is a Cape Town statement, but not the Cape Town statement. You're very welcome to sign on to that one too. But I will now read you the Cape Town statement. I have to say that when I last looked at this, just before we came on stage, it was rather long. I'm hoping that it's got a bit shorter in the intervening minutes, but please bear with me in any case. So the Cape Town statement from the 3rd Global Symposium on Health Systems Research. Cape Town welcomed the world to the 3rd Global Symposium on Health Systems Research between September the 30th and October the 3rd, 2014. 125 countries were represented by almost 2,000 participants who gathered to discuss and debate the science and practice of people-centered health systems. Over the course of the symposium, which included 4 plenary sessions, 170 concurrent and satellite sessions, 572 posters, and 11 films, delegates had the opportunity to immerse themselves in the field of health policy and systems research. Policymakers, activists, community representatives, managers, researchers, and educators from around the world shared new information and insights from their experiences with the journey to universal health coverage, the theme of the 2nd Global Symposium, and developed a deeper understanding of people-centered health systems. This statement was synthesized from broad-ranging discussions over the 3 days of the meeting, drawing upon rapporteurs' notes across all the sessions. Our discussions recognized that health systems need to be reoriented to respond to people's emerging health needs, be directly accountable to ordinary people, and respect and ensure the rights and dignity of all people who use health systems and provide health care. Nowhere is this need more apparent than with the recent Ebola epidemic in several West African countries. Ebola and other health challenges worldwide highlight the need to redouble attention on health system challenges, including the unequal availability of resources underpinned by existing power relations between and within countries, the variable quality of health services, and the lack of appropriate health information to assist those at the front lines of healthcare. The drive towards universal health coverage should be led by citizens and local and national governments rather than by external actors, and in line with the needs of priorities of communities and citizens. Many crucial drivers of health system change lie outside the traditional boundaries of the health system. Social mobilization and intersectoral action are critical for reorienting health systems to be more people-centered. Community health workers can play an important role, linking role in enabling inclusive and representative community participation. We need to promote local institutional mechanisms that support inclusive and representative community participation in health, recognizing that the collective voice can drown out the needs of the most marginalized and vulnerable. Health systems serve people, but are also made up of people who need effective environments in which to work, which should include appropriate financial and non-financial incentives. Barriers to access to care must be removed, including financial barriers that exclude the poorest and most marginalized. Governments need to provide sufficient funding for the provision of effective and responsive care and develop effective financial protection mechanisms. Progress since Beijing. We note with pride the accomplishment of key milestones committed to in Beijing in 2012. Building on the 2012 WHO strategy for health policy and systems research, there has been a consolidation and growth of the health systems research community. Health Systems Global now has over 1,500 members from more than 90 countries, and the society has further developed through 9 active and engaged thematic working groups and a renewed board. The third symposium has demonstrated the vibrancy of our community. Actions. The symposium covered a number of action themes, including health systems development, cutting-edge and innovative research and research methods, capacity development for research, and learning communities and knowledge translation. First, informed by discussions and research presented during the meeting, there are a number of important areas for health system development. The focus on people-centeredness brought new perspectives on our thinking about how to realize universal health coverage, including the importance of community-led governance, national ownership and leadership of health reforms, and inclusive health systems development. Key among the research topics and methods discussed were ways to promote understanding of civil society and social movements that support people-centeredness, developing our understanding of health workers, particularly mid-level health workers, their felt experiences, and how to empower them to provide people-centered health services, allowing the experience of communities and health workers to be heard through use of participatory research methods that engage and empower communities, understanding scaling up of health programs in different contexts. On capacity development for health systems research, we acknowledge and applaud the emerging voices and leaders amongst us, and recognize the need to continue to strengthen our efforts to nurture the future generations of the health systems community. It is important to address inequities in the availability of health systems research training and to deepen and expand efforts to strengthen teaching for health systems development and research. Of knowledge networks and learning, we have noted the need to extend our communities through bringing together diverse groups, to develop skills to communicate about health systems amongst diverse constituencies, for journals to create space for people-centered knowledge and other innovative forms of health systems research, and promote learning from implementation and capture tacit knowledge. These actions have different implications for different actors. We note in particular that funders need to engage in longer-term funding of research programs and research capacity building, and we encourage them to help reframe research funding models so as to better engage local stakeholders. This is the first meeting where the Health Systems Global thematic working groups met and began to coalesce into communities. The thematic working groups will help take forward these and other recommendations arising from the symposium. Conclusion. So this is veering a little from the text. There is a city somewhere eagerly anticipating the arrival of the Global Health Systems community in 2016 for the 4th Global Symposium on Health Systems Research. There we will evaluate how far the world has progressed towards adopting a people-centered approach to creating sustainable, equitable, responsive health systems for the benefit of all. In the words of one presenter at the 2014 symposium, "We are one world, united in a quest for health for all, beyond the borders of politics and economics. We encourage researchers and funders to contribute towards this global vision." Thank you. And I hope that that statement captures many of the concerns and the issues that have been discussed here, and that you collectively hold important to you. Our plan is to post it shortly on the website, and as a product that I think we've all shared in the creation of, we would really appreciate your support in disseminating it. So please tweet it, put it in your newsletters, and above all, promote action on it going forward. So my next job, and this is always a pleasurable one, is to make some awards. There's been a truly wonderful display of posters downstairs, with over 570 posters displayed in total. And I think we were reflecting earlier on how difficult it has been to really do due justice to those posters. They've been changing every day, and there's just some amazing work down there. But each day there has been a panel of judges, actually in many cases an army of judges, given the number of posters, who have been going around to review the posters and identify 3 winners. So here we have the poster competition winners, and I'll read them out to you. The first place winners are Nan Ya Bawadu. You want to cheer? Prisha Oria and Melissa M. Alvarez. Second place winners, Aditya Pradyumna, Astu Kohli, and Joanna Raven. And third place winners, Yogesh Sabdi, Alistair Agar, and Gordon Shen. And I'd like to ask if all the winners can meet at the Winners' Circle in the poster display area to collect their prizes and to have your photographs taken immediately after this plenary. I also have one more winner from the Social Media Award. This was the award for symposium coverage that we weren't able to award last night because the coverage wasn't finished yet, the symposium wasn't over. But the award has now been given to Tana Wuliji for her coverage of the symposium. Thank you very much. Congratulations to all of you. You've done an amazing job in being selected from such a large field. So we've been trying to keep it a secret. I'm not quite sure how effectively we have done that. It's perhaps not the best kept of secrets. But in May this year, Health Systems Global issued a call for proposals to host the next global symposium on health systems research. And we were really delighted to receive 3 high-quality proposals from different parts of the globe. We did a very thorough and careful review of those, and we have decided to take the next party to Vancouver, Canada. I think that many of our Canadian colleagues, we have some on stage here as well, both those inside Canada and those outside and scattered across the world, and there are many of those too, have really been stalwart supporters not only of this symposium, but the development of the field of health systems research. So we're really delighted to have this opportunity to visit them in their home country. And the Canadian Society for International Health, together with other Canadian partners, will be hosting the symposium. And I'd like to invite Donald Sutherland, who's representing the Canadian Society for International Health, up onto stage just to say a few words and to welcome you to Vancouver.
Well, I'm delighted to be here, and I'm glad the secret's out because I think I've been telling people already. Anyway, I 4 weeks ago didn't know anything about this, and if you said the phrase health systems research to me, I'd have said, what? But I must say that in the last few days, I've learned a lot, and I've been very impressed, extremely impressed with the focus and the quality of the work that's done here. I really think you should congratulate yourselves on a wonderful session. And so I would congratulate the board, the co-sponsors, the local committee that I'm also very impressed with, and we have a tough act to follow, of course, but the delegates for such a good symposium. And also for the content, which is very powerful and needs to be heard. So we are looking forward to seeing you all in Vancouver. Maybe we can have the next slide. This is downtown Vancouver, and where the boat is moored is right where the conference center is, so it's a spectacular location for the next meeting. And I would encourage you all to bring your results from your research, your messages, and your challenges to Vancouver. But because I spent 25 years working in HIV and AIDS in Uganda, at a global level, and also in Canada, we were fortunate to have a very powerful advocacy group everywhere we went to add the melodrama that was necessary to do something about HIV and AIDS. So I think we need some 7-second sound bites. We need some activists and political statements about the work that's so important. And so I say, bring your emerging voices to Vancouver, please.
So thank you very much, Donald. It looks like we have a wonderful venue to go to, and now we need to start work on lining up the band for the evening's events. Finally, I would like, on behalf of Health Systems Global, to thank the many, many people who have made this year's symposium the success that I think we all think it's been. I'd like to start with the hundreds of volunteers here who have helped direct us to the right rooms, carry microphones, find glasses of water when we've choked up. And also the scores of people who have been working behind the scenes to make this all go smoothly. The technicians, the conference center staff, the professional communicators, as well as the conference company which manage many of the logistics for this symposium. Thank you very much indeed. Many of the members of Health Systems Global have made very significant contributions to the success of this event. From members of the scientific committee, to the armies of judges of the poster competition, to rapporteurs capturing sessions, chairs running sessions, and the colleagues who were desperately trying to write the final statement today. I thank you all for your contributions. This event would not have been possible without very significant support from a variety of international donors. I don't have time to list all of them here, but please know that your contributions are really, really appreciated. And we're particularly appreciative of the trust that you placed in us this time round as a new and somewhat unknown society and our ability to be able to host this event effectively. We hope that we've established strong working relationships and we can continue to work with you going forward. Health Systems Global co-hosted this symposium with the Alliance for Health Policy and Systems Research, the World Health Organization, and the Department of Health South Africa. We would particularly like to acknowledge the strong support and excellent cooperation with these agencies, which has really made the planning process much smoother than it could have otherwise have been. And we're particularly grateful to DG Matsoso for her leadership in this respect. We would also like to acknowledge the members of the Executive Committee and the various working groups who have worked continuously over the past 20 months to plan, prepare, and stage this symposium. Finally, and you know I've been saving the best till last, we would like to extend our deep-felt gratitude to the local hosts, the University of Cape Town, the University of the Western Cape, Stellenbosch University, the Health Systems Trust, and the Medical Research Council of South Africa. And in particular, we would like to thank all of the members of the South African Local Organizing Committee. I'd like to ask you all to stand up because you have been just such wonderful resources and helps and aids. We have been extraordinarily lucky to have such an engaged, organized, active, superlatively competent, and totally committed local organizing committee. Thank you to you all. I would particularly like to single out, and we kind of knew that they might not appreciate being singled out, but we're going to do it in any case. Lisa Marie Smith, the local coordinator. And Professors Di McIntyre and Lucy Gilson. Please, can I ask you to come up here on stage so that we can acknowledge you in public? I can see Di, she's like, Come on. Oh, I don't know who, this is Irene, don't worry. In closing, I hope that during the past few days, you will feel that you've gained new perspectives on people-centered health systems, perhaps sometimes had your own perspectives challenged. I hope that you've met old friends and colleagues, but also had the opportunity to develop new ones. Moreover, I hope that you feel renewed passion, energy, and commitment to strengthening health systems and making them more people-centered, wherever you may be working across the world. As we leave this room, I would like us to think about the many people who could not be here with us. yet they are the people who are typically at the center of health systems. The health workers, volunteers, and communities in Guinea, Liberia, and Sierra Leone who are working under extraordinarily difficult conditions to control an unprecedented outbreak. But also the communities and health workers who are not currently in the media's lens, but who struggle every day, sometimes to look after dying loved ones in conditions of poverty, sometimes to provide services to entire communities in context where low pay, poor working conditions, and threats of violence prevail. Let us try to capture some of the energy, wisdom, and community support that we have extended to each other here during this meeting. And when you return home, spread it around a little. Sprinkle it in the communities where you work. And let's seek together to truly make health systems more people-centered. Thank you.